Now, I wrote a book called Dying of Whiteness, as we just heard, and the book came out 2 or 3 years ago. And at the time that the book came out, my sense was I wanted to write a book that was a warning. What I was seeing across red state America, I'm somebody who, as I'll say in a minute here, grew up in Kansas City, Missouri. I live in Tennessee. And I saw things that were really concerning to me about the kind of decisions people were being asked to make in defense of their own identity and in defense of their own politics. And those issues were being fomented by politics, by media. And for me, my aim in writing the book was to say, hey, look, here's what's happening across Missouri, across Tennessee, across Kansas, and to warn people that this is something we need to address as a nation if we want to improve the health of our nation. Now, unfortunately, what happened was that the fault lines that I think I identified in that book really became, I mean, they were just, to be honest, not exactly hidden after the pandemic started, the election, all the things that happened, where the kinds of polarizations that I was writing about in the book became unavoidable parts, really, of our own political landscape. They became unavoidable parts of our own political reality. And so, in a way, the reason, and I think prescient maybe is a good word that I didn't realize at the time, what was prescient was the power. I think the power of the story you're about to hear about this book was a power of a story that was asking people to put their own biology, their own well-being, behind a bigger ideology, an ideology about politics, an ideology about race, an ideology about what it means to be a particular person. And so for me, the moment where I thought, oh man, we're in for it, actually started in the first couple of months of the pandemic. And by the way, can everybody hear me okay? Everybody good? Okay. So the first couple of months of the pandemic, there was a moment where this is like March, April 2020. And it's like, we're Republicans, we're Democrats, we're libertarians, whatever in this country. But all of a sudden there was a new pathogen on the loose in our country. And that pathogen didn't care what our politics were, really. That pathogen didn't care what party you belonged to. It just wanted to infect humans. And at that moment, it was a moment to say, look, we're all vulnerable by nature of being human, and some of us are more vulnerable than others. And this is a moment to just shore up our infrastructure, right? Let's make sure everyone has health care. Let's make sure that there's a network where if people get sick, they can go see a doctor. They're not going to go to work with COVID and give it to other people. And there really was, I think, a moment of terror across our country, and there was a question about how is the American political system going to respond really to this moment. And I think initially, remember, we were like on our balconies cheering for healthcare workers and ringing bells, and we wanted to be like people in Italy and people in China and things like that. And then the polarizing machine of our country took over. And for me, the moment that really signaled that was that we have a national healthcare system in this country. It's called the Affordable Care Act. It's for better or worse, it's what we have. But under the Affordable Care Act, the government can expand Medicaid. Every single person in the country can have health insurance tomorrow under the law, under the Affordable Care Act. And there was a moment where people were like, what are we going to do about healthcare? What are we going to do about healthcare? And at that moment, the Trump administration signaled to red state governors, we're going to double down. In fact, they submitted a brief to the Supreme Court saying, we're going to overturn the Affordable Care Act. And so at the moment where we could have and should have expanded Medicaid for the entire country, the signal to the country was, no, in fact, we're going to double down on polarizing politics. And I'll tell you in a minute what that means. But that was a moment, I think, of profound implication. And we've seen this through the pandemic where all these divides, I mean, there really wasn't a debate about the economy or health. Everybody wanted health and everybody wanted the economy. It wasn't like somebody was for health, but they were against the economy. But these divides, I feel like, were exacerbated. They were militarized across much of the country. If 2 years ago I would have told you, or 3 years ago, hey, there's a pandemic that's going to kill, how many million people? And in order to not die and not kill people in your community, all you have to do is wear a non-invasive technology that costs 99 cents. You can get 20 of them on Groupon or something like that. And it doesn't go into your blood or anything like that. 3 years ago, people would be like, hey, cool, no problem. But this symbol of what it meant to be adherent to public health became politicized. I was flying the other day. Here's a gentleman who I ended up speaking quite a bit with on my flight. You have to wear a mask in the Nashville airport still. And I went up to him and I said, who'd you vote for? Yeah. But he was showing his disdain for public health by wearing a Trump mask, as he told me the mask did not work. Actually, it was a porous mask. But, you know, your stance in relation to public health itself became a political statement, and not only a political statement, but a divisive one. And we saw this go through, vaccines, of course. And so really, we knew this before, probably it was always true. But it's become so clear during the pandemic that really our brains are polarized. Our bodies are polarized right now. And that kind of polarization about matters of health, because, of course, the flip side of this is wearing a mask is a performance of a kind. I mean, it's also, thank you all for wearing a mask. But I would say that, our performance in relation to public health really in particular became a sign of our identity. And so that kind of polarization has been so exacerbated in this moment of existential dread, right? And so polarization, as we know, suffuses the media, the social media, political institutions, the judiciary. None of these places are built for the kind of compromise you need. In other words, no judge is going to now go in and say, I don't know if I'm a Republican or a Democrat. I just want to hear the facts of the case and decide. I mean, somebody tried that last week in a hearing, but it was, again, interpolated into the polarized order. Politicians are not not voted into office to compromise with the other side. Just try being, Liz Cheney right now, I'll lose. There are a lot of different reasons why this happened, but my work, I'm a race scholar, shows how that breakdown in governance was flamed or obscured by racial tensions. When I say whiteness, I don't mean there's some genetics or biology of whiteness, and there are many different ways of being white. But I do think that the rise of a kind of politics that was expressly anti-government, anti-immigrant, pro-gun became the dominant narrative of a political party, which then became an identity. Now, their main goal was to defund local and state governments and then the federal government. And what happens when you defund state government is that you defund these kind of apparatuses. So all of a sudden what happened was the Tea Party took over, the anti-tax party took over, and there was a lot of kind of smoke and mirrors and all that kind of stuff. But what happened was when you start defunding stuff, taking money out of stuff, what gets cut first are these communal spaces where people learn to get along with each other. And so that was exactly what happened. And the other aspect, of course, was that this was aligned with NRA politics. And so this was also a strongly pro-gun, pro-NRA politics, which now is on steroids. And part of what happened is that if you defund these public spaces and you flood a lot of guns into the zone, all of a sudden people stop engaging with each other in a way that is collaborative. All of a sudden it's like, oh, I wouldn't go there because that's a threat. Why would I send my kid to that summer camp? Then the disinformation machine took over. The disinformation machine that tells you that it's the government intrusion into your lives, that it's an intrusion onto your freedom and liberties. And all of a sudden, these Obama witch care doctor racist posters started showing up at Tea Party rallies. And the minute you say, really, there's a pretty regular playbook in the South. If you just say three things, it's government intrusion into your life, it's an affront on your freedom and liberty, and black people are going to cut in front of you in line and take resources that are meant for you. If you say those three things, people then start protesting against their own health care. And that's exactly what happened. We saw that people who a minute before that had been saying, oh, this is great, I want some health care, all of a sudden started saying, I'm totally against the Affordable Care Act. Now, this is when we started doing some research. So my colleagues and I, as I'm mentioning, started doing focus groups across Tennessee. And the focus groups we did were largely in low-income housing communities that were on the outside of cities like Nashville and Memphis. And these are really, really poor areas. People are coming to these groups, and it was really, I have to say, one of the more powerful experiences of my research life. Now, a focus group is a group of 12 people who sit around a table, you go in the room, you ask them questions about healthcare reform, stuff like that. But the stories we would hear when people kind of came to the groups, these were men, the kind of average story was something like, Doc, I had a pretty good life. I was a manager of a restaurant, or I ran a car dealership, something like that. Things were good. I had a family, I had a house, I had a mortgage. And then one day I got a bloody cough, or I had a pain right here where I think my liver is, or my feet were numb, something that suggested not just that they were going to have a chronic medical illness, but that they were going to have an incredibly expensive medical illness. And in a state like Tennessee that doesn't have a social safety net, in many ways, a chronic illness like that is an economic death sentence in a way, because there's nobody's going to catch you if you fall through the cracks. And so part of the story that we heard were just stories of remarkable bravery, really about what it meant to stay alive in a state system that, and just to put it crassly, it's much cheaper for the state if you die. And so just getting to these low-income housing communities was itself an incredible act of persistence, of resilience. But I would also say that there was a lot of racial disparity in the kind of answers we got. And I say that because we asked the groups kind of the same questions, but the groups were divided by self-identified race and a bunch of other factors. And so when we would ask the groups, and I'm going to show you groups from Black and white men, although we did other groups as well. But the focus group, you kind of start off, the first 15 or 20 minutes is kind of like a cocktail party, chit-chat, what'd you eat for lunch? How you feeling today? How about the weather? How about the Titans? That kind of stuff. And then about 15 minutes in, you ask the kind of hook question. It's a question that people have an emotional response to, but that there's no one answer. And our hook question was, okay, we have this thing coming down the pike called the Affordable Care Act. We didn't say the Affordable Care Act. We didn't say Obamacare. We called it healthcare reform, and we said, who benefits from healthcare reform? We didn't say, how do you feel about it? Are you going to get on it? Or something like that. We said, here's the Affordable Care Act. Who benefits from it? Asking people to project. And across the board, when we would ask Black men, who benefits from healthcare reform, we would get answers like this. I think society does, and that it keeps people having insurance. It keeps costs down for everyone. I think because people are healthy, because of checkups and things like that. I think as a society, we all benefit by having people insured. Someone has to protect the citizenship, not just Black people, but protect us as a country, Now, for me, these are remarkable answers. These are poor Black men in the South. Many actually have medical conditions. And I think there was a real drive to say, well, I've been treated badly by the system, and now the system should pay me back, right? I think there should be, if it was me, I'd say, I want healthcare to work for me. I want the healthcare to work for my system. I want there to be an answer to the structural violence that I face every day. But that's not what these guys said. They said, everybody benefits. A rising, tide raises everyone's boat. And they were also very proud that this was coming from the first Black president. And so I think that this is the kind of answer that you want people to give. And it's also the kind of answer you want people to give because if you're creating a national health system, you want everybody in the system. So you want people to have this attitude because the more customers there are in the network, the more if one person breaks their finger and one person needs a kidney transplant, there's enough money in the system. So these were, I think, almost routinely the kinds of community-based answers we heard from Black men. Now, unfortunately, when we talked to men, the language they used was so incredibly different. Who benefits from healthcare reform? Here's a standard answer. I'm 53, I've had 2 heart attacks, I have a chronic cough, my diet sucks, I work 12 hours a day flipping burgers, and I come back to my room, eat junk food, watch TV, and fall asleep. I'm a ticking time bomb health-wise. I've got high blood pressure bad, just like my dad did, and he died young. And I'd be like, and thank you, sir. Who benefits from healthcare reform? And he'd say, I ain't supporting Obamacare, no way, no how. I ain't signing up for it neither. And I'd be like, well, why is that exactly? And this was an answer I heard hundreds of times over the years of these groups. I know this program might help me. I know it might save my life. In fact, in this case, it would have probably prolonged this man's life. But I'm not going to join a system that's going to benefit undeserving others, undeserving immigrants or minorities. As he said, ain't no way I want my tax dollars helping Mexicans or welfare queens. Now, I heard this a zillion different times. A lot of people use Obamacare. They use it up. They're not sick. They go to 2 or 3 doctors. They use the shit out of it. And when somebody really needs it, it's not there for them to get. There's a lot of people that use welfare. They need to get jobs, quit having children. I'm not saying everybody. I'm just saying people with 10 or 12 kids, there ought to be a cutoff point. Well, I'm just saying they're use it up. It's about time. And so in the numbers that we saw people, and so there was a data project that we did. And so it wasn't just the social construction and cause to fix common problems like building an economy or something. And why don't poor white people and poor black people get together and solve these problems? And the answer he came up with was that there is a wage about health. Now, before I finish up, I'm going to tell you that the book spans other issues other than healthcare with other racial groups. And that was that there is a wage, you're paying with your own healthcare system, pulling garbage like this, and help in terms of health outcomes. So that the last part of this part deserve it, we're out to use about health. Now, before I finish, through which people would get of what were called the gun super owners, people who owned 30 or more semi-automatic weapons, I can tell you that through the early 2000s, there were a lot of people who owned guns in Missouri. This is real illness. But I hope you can heal from those quotes. They were all my life. In fact, in this case, it would have probably prolonged this man's life. But I'm not going to join a system that's going to benefit undeserving others, undeserving immigrants or minorities. As he said, ain't no way I want my tax dollars helping Mexicans or welfare queens. Now, I heard this a zillion different times. A lot of people use Obamacare. They use it up. They're not sick. They go to 2 or 3 doctors. They use the shit out of it. And when somebody really needs it, it's not there for them to get. There's a lot of people that use welfare. They need to get jobs, quit having children. I'm not saying everybody. I'm just saying people with 10 or 12 kids, there ought to be a cutoff point. Well, I'm just saying they're use it up. It's about time something, or it's not going to be there anymore. The worst thing is what really pisses Americans off is that we are pocketing all the Mexicans, all the mother truckers, their houses, their food stamps, everything they want, we're paying for. Now, again, these were men who were chronically medically ill in the South. These men were literally dying. And in fact, over the course of the research, a number of the men did pass away. They wouldn't show up to the groups for a while, and it was a very ominous sign. And so the story of the book is, what were these men dying of, really, in a way? And I want to be clear, they were dying of 2 things. On one hand, they were dying of real biological illness. I don't want to say that this is socially constructed or that it's anything other than this is a national failure, right? You shouldn't have the resource of the United States. And I mean, some of the people were dying, men in their 30s with remarkable jaundice, couldn't sit down in a chair because the hepatic pain was so intense. Untreated medical illness, the kind of medical illness you should not see really in a country like ours. So this isn't just the social construction of illness. This is real illness. But I hope you can heal from those quotes. They were also dying of an ideology that told them that there were privileges that were due to them as white Americans,